The quadriceps femoris muscle is innervated by the femoral nerve, which is derived from the lumbar 4th, 5th, and 6th nerve roots. Tensor fasciae lati is innervated by the cranial gluteal nerve, derived from the 5th and 6th lumbar and 1st sacral nerve roots. And biceps femoris is innervated by the caudal gluteal nerve, derived from the sacral roots of the lumbosacral trunk. And here we can see the femoral nerve, D, the cranial gluteal nerve, F, and the caudal gluteal nerve, N. Let's now consider some aspects of forelimb conformation. In the horse on the left, if we look at the top and the bottom yellow arrowheads, we can see that the horse has a base narrow conformation. The distance between the front feet is considerably smaller than the distance between the proximal aspect of the antebrachial regions. And as a result of this, if we drop a perpendicular line from the right shoulder to the ground, this line does not bisect the limb and finishes outside the lateral aspect of the hoof capsule of the right forelimb. In the chestnut horse on the middle, we can see that the medial styloid processes of the radius are asymmetrical in height, being higher on the left forelimb compared with the right. This was associated with a taller foot on the left side compared with the right side, so that the coronary bands are not symmetrical in level. In the horse on the right, we can see a horse with a broken back carpal angle or overextension or back at the knee conformation. And in this horse, we can see abnormal prominence of the extensor carpi radialis muscles, which had abnormal tension. There's massive enlargement of the right front superficial digital flexor tendon, extending down into the pastern region. Hyperextension of the fetlocks, associated with lack of support from the superficial digital flexor tendons, and broken forward pastern futaxes with a toe out conformation. Note how chest narrow this horse is as well. In the horse on the far left, we can see that the pasterns and hoof capsules are rotated outwards. In the horse in the middle, if we drop a perpendicular bisector from the top of the antebrachium to the carpus, we can see that that line is not in alignment with a perpendicular bisector of the metacarpal region. Moreover, that second perpendicular line does not bisect the hoof capsule. There is more foot towards the medial aspect compared with the lateral aspect. We can also see that the height of the coronary band is different on the lateral aspect, being smaller compared with the medial aspect. In the grey horse on the right, again, the perpendicular bisector of the antebrachium is not in alignment with the perpendicular bisector of the metacarpal, pastern and foot region. And this kind of bench knee conformation predisposes horses to the development of osseous enlargement on the proximomedial aspect of the third and second metacarpal bones to effectively provide more support. In this horse, we can observe that the horse has a sloping pelvic conformation. The hind limbs are somewhat camped under the trunk,